From mid-January this year, the COVID-19 daily statistics from the Ministry of Health show a steady test positivity rate averaging at 5%. Test positivity rate is the percentage of people who test positive for the virus of those who have been tested overall. The incident commander at the Ministry of Health, Lieutenant Colonel Dr Henry Choba, says a positive rate of less than 5% is an indicator that the infection is under control.
This wave largely driven by Omicron, but certainly we had co-saturation of both Omicron and Delta, but Omicron quickly wiped out Delta to a greater extent that by January we don't seem to see any Delta saturating. Near the entire country is within control phase. That is where we have under 30 cases per 100,000 population within a week.
The number of new infections also declined from an average of 300 per day between December and January to now less than 100. Dr. Choba says this has a direct impact on the rate of hospitalization.
Hospitalizations usually come a little bit later, they drop, or they peak after the actual peak of cases. And usually the drop in the hospitalization also drops afterwards.
Uganda's performance is hinged on accelerated vaccination, amongst other measures put in place at the start of the pandemic in 2020.
So we're still thinking that there are possibility of a seasonal pattern. That's a likelihood. But also remember that as we speak, we have dispensed almost 14.5 million doses of vaccines to individuals. But also these viruses have a tendency that, as we saw in Omicron, the intensity of transmission, the force of infection was so much. What happens that they quickly use up the susceptible individuals. So the people who get infected become fewer and fewer. And they become fewer and fewer, then even the transmission goes down.
However, the deaths still average 6 to 8 per day, which is high, and this is why.
This, of course, in the category of senior individuals, more and more senior individuals. Here we are talking about 50 years and above, but of course peaking beyond 60%, and much more in the 80s, 70s and 80s. But what is important to note is that most of these, nearly close to 60% of those who die are not vaccinated.
This, therefore, according to Dr. Choba, does not mean that we are out of the woods, since the restrictions on movement and gatherings have been removed.
The bug itself keeps changing. The SARS-CoV-2 keeps changing. And you recall we thought by this time last year we didn't have cases. Through the entire month of Feb and some part of March. Before then we had, soon after then we had Delta, and things changed. So there's no way we should drop the guard.
Uganda's approach towards fighting the COVID-19 infection was critiqued in equal measure for slowing the infection, but also on its negative impact on people's livelihoods due to the prolonged lockdown. Walter Mwesije, NTV.